Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, this is Annie Rogers, and on behalf of Attitude Magazine, I'd like to welcome everyone to today's ADHD Experts broadcast. We are extremely pleased to welcome Dr. Caroline Buzanko, who will explain to us how to distinguish signs of ADHD from typical toddler preschooler behavior by comparing and contrasting common behaviors and challenges, and also how to best support our kids as their executive functions, their ADHD brains develop and grow. Dr. Buzanko is a licensed psychologist and clinical director of Koru Family Psychology. She has worked with children with neurodevelopmental disorders and their families for more than 20 years and focuses on maximizing connection, confidence, and resilience. She facilitates ADHD-related groups and workshops across North America and is an adjunct assistant professor at the University of Calgary. Before I turn over the mic, before we get started, I do have just a few housekeeping items. Those of you tuned into the live webinar may download the slides now by clicking on the Event Resources section of your webinar screen. And if you're interested in the Certificate of Attendance option, please look for instructions in an email. You will receive that email about an hour after we wrap up the live broadcast. For those of you listening later in replay or podcast mode, please visit the webinar replay page on the Attitude website, attitudemag.com/podcast-325 for access to both the accompanying slides and the Certificate of Attendance option. So with that, I would like to formally welcome Dr. Buzanko and turn over the mic for today's presentation.
Perfect. Thank you so much. A little bit of a disclaimer. I have ADHD myself, so I talk really, really fast. Most of the important notes, though, are in those handouts, so definitely have that. And I have an extra resource that you can download as well, which I'll talk about a little bit, which will be in the resource section. So thank you for joining me today. I'm very excited. I do want to talk about quickly, ADHD can be an asset when it's identified, when we know it's there, and when it's treated effectively. However, when it's missed and when it's left untreated, it can really interfere with kids' success at school, as well as their social, emotional well-being and their behavioral functioning as well. So that's why this is really an important webinar, because I can't stress how important early identification is and that intervention piece for helping our kids so that they can experience success in all areas of life. Because unfortunately, the majority of young children with ADHD, they don't get those early supports that they really need. And we know early intervention is so critical. Lots of parents think, maybe their kids will outgrow it, or doctors want to err on the caution, be cautious about giving the diagnosis. And the American Academy of Pediatrics, actually, they indicate that kids younger than 4 really shouldn't be diagnosed. But we can start seeing symptoms as young as 2, and in some really severe cases, even earlier as well. So, I joke even with my daughter, she has ADHD, and I joke that I knew from the time she was in my womb that she had ADHD, but I did suspect for sure by the time she was 2, she had ADHD. And there's really big differences in the brains of kiddos with ADHD and without ADHD. So it makes sense that we would see some of these early markers that I'm going to talk about today. And we want to make sure that we're identifying them so that we're not missing out on those really important intervention opportunities. So let's jump right in, because there's lots to go through. So that's why it's really important that we're aware of these early signs of ADHD. Now, when we're looking at the diagnostic criteria of ADHD, it focuses on behavioral deficits in which kids, they're really not meeting our expectations, whether it's in the classroom or at home. So let's start with some of these key behavioral markers to watch out for. ADHD, it's definitely multifaceted. There's a general consensus, though, that symptoms fall into 2 broad categories. One is the faulty inattention, and the other one is the hyperactivity impulsivity. So we can look at this here. So with inattention, unfortunately, this is definitely a tricky one because it's pretty common for young kids and toddlers, and even kids as they start going into school, to be inattentive. So it can be really hard to notice. But you might notice that your young child has lots of trouble focusing on any one thing or listening long enough even to sit through a little story that you're trying to tell them or read a story to them, or they're having trouble settling down, such as to take a nap. I had to give up naps for my daughter by the time she was 1, just because she just couldn't settle down ever. It seemed like she was never getting enough sleep. And as kids get older, they should definitely be able to attend longer. So kids with ADHD, though, even as they're getting older, they're still having trouble attending for very long, even sitting down for a meal, for example. I mean, my daughter could never sit to eat because she'd always have to get up every 3.2 seconds or twirl or show me something. Mommy, look, mommy, look, mommy, look. She'd have a magic trick. There's always something different. Even watching a TV show was a nightmare because I was always getting hit with elbows or kicked in the face because she's trying to do somersaults on the couch or whatever it was. She just couldn't even sit through a short little TV show. Even now as a teenager, sitting through a movie can be really tricky for her. Kiddos can be really easily distracted and have trouble staying on task. The inattention definitely tends to be more noticeable once kids start school. And then teachers can see, how are they comparing to other kids? But it is trickier with our younger toddler. So we tend to focus on other things. Now, the one thing with the inattention that's really important to know too, is that it's not that they can't pay attention. A lot of parents are like, well, it can't be ADHD because my kiddo can sit for hours playing Lego. That's not it. It's when they can pay attention to things we want them to pay attention to, or follow through with things that we want them to follow through with. When we look at the hyperactive, impulsive sort of behaviors, again, many kids who are young, who are toddlers, have hyperactive, impulsive behaviors. But again, we see their hyperactivity improving with age. Kids with ADHD, though, they have a lot more difficulties than other kids. So it's just kind of to excess. Everything's to excess, excessive, inattentive, excessive, hyperactive. And a lot of these things can cause a lot of problems for our kids. So the really hyperactive and impulsive kids, they're kind of exhausting to a lot of people around them because, they're just always on the go, or they are walking safety hazards. You just never know. Like, watch out for the cars. They run into the street running after their ball. Oftentimes, the most severe hyperactive impulsive are easily identified early on. Just because they're never stopping. They're always talking. They're leaving adults exhausted. Really, that's at the end of the day what ends up happening. And again, the difficulties falling to sleep, and they just seem to have less stress, need less rest than other kids. When we look at infants with ADHD or who are at risk of developing ADHD, they usually have trouble feeding. And it could be various reasons. I know when I had my daughter, I was always visiting the nurse, the lactation consultants, because she would literally eat for 2 minutes and then she'd get distracted and she'd get so frustrated. She'd get so angry because she just couldn't stay to nurse. She wanted to get up and move. And so we need to look at sort of those eating patterns early on. Kids with ADHD, they also have trouble waiting to get things they want or for waiting for their turn. They tend to play really loudly and they really just don't identify danger. So they might climb high places, or they might run into dangerous places like running into the road, or even just clumsiness. They might hit their head on the corner of the table because they're running so fast around the dining room table or the coffee table. And some kids need stitches, or they're getting lots of hits to the head, concussions, and the climbing thing. So it's just like constant go, go, go for a lot of these kiddos. Now, although the inattention and hyperactive impulsive are generally referred to when we're diagnosing ADHD, one of the hallmarks of ADHD that are not outlined really in the diagnostic criteria is this emotion dysregulation. And this is really a key feature of ADHD and actually one of the best early warning signs of ADHD. So kids who display emotional dysregulation, such as those who really anger easy, or even they're just easily excited, right? We're going to go to the park. And then it's like, we're going to Disneyland because they're just so excited. They are at great risk for ADHD. And the more severe their anger outbursts and the more easily excitable they are, the more severe their symptoms can tend to be. So I think that's important to consider as well, as just some of this emotion dysregulation piece. So what are some of the signs to watch out for? Well, as babies, they tend to show negative emotionality, meaning they respond poorly to any stress. They react with unpleasant emotions. The babies who may be at risk for ADHD, they're the ones who cry constantly. They have trouble with self-soothing. They're angry. They're fussy. They have a hard time calming, right? No matter what we kind of do, they have a really low frustration tolerance. Just things are setting them off all the time. And given their difficulties, these kids also have troubles, like I said, feeding or falling asleep, staying asleep, and they just are really intolerant of any sorts of frustration, anything that kind of goes wrong. As they move into toddlerhood and develop more language, typically developing kids can really start better talking and expressing their emotions. So they're regulating their emotions through language, and they're able to follow rules, and they're able to show a little bit more flexibility. However, kids with ADHD into toddlerhood, they're still having a hard time managing anything challenging and coping with their emotions, and they're avoiding things or giving up really easily. Their tantrums tend to be more frequent, more intense, more severe. And when we have our typically developing kiddos, we can usually figure out why the tantrum's happening, but we can't always for kids with ADHD. It could be anything. And that's true for all kids, really, but even more so for kiddos with ADHD. And unfortunately, it's really hard for them to calm down because they're so easily overwhelmed with their emotions, and their emotions are way more intense than other kids. And again, it's true if they're overly excited, in which case they go overboard. They tend to be more controlling in their interactions with other peers. It's just to help them cope with everything that's going on for them. Young kids with ADHD, too, can also be more angry and aggressive. Their frustration tolerance is really low. Again, they're giving up way sooner than others without ADHD, especially if they can't do something right away, right? If they're trying to do a puzzle or trying to put a car together or learn how to ride their bikes. Small kiddos with ADHD, they can be moodier, they're more irritable, and it can be really annoying or frustrating for parents when their kids are whining or demanding things all the time, which can then escalate to a lot of aggression. Just again, hard time waiting, and then they're exploding because I need to have things right now. I can't wait till after dinner to have my cookie. And they also have a hard time for corrective feedback. They're really sensitive. Even if you're just like, hey, kiddo, just put your shoes by the door, right? We're just kind of correcting their behavior a little bit. They're really sensitive, and that could really result in like a scream, a huge meltdown. So here's an example of some of the major emotional behaviors and signs that we see between typically developing kids and those with ADHD. And we can really start seeing that young kids are at risk with ADHD because they're more extreme than other kids, right? We might see more extreme aggressive behaviors, for example. So you will have this in your handout, so I won't go through that in great detail. The other thing is peer rejection. That's a really important warning sign of ADHD because these kiddos tend to be overly intrusive, and they're going to jump into other people's activities. They're going to interrupt, talk over, take over the games. They might grab the toys, get right into their face, and just over controlling, and they can be really aggressive as well. And so when they're too in your face or they're always taking your toy, other kids don't want to play with them. So that's another major sign when we're looking for. So let's get into, those are the early signs. Let's get into the actual diagnosing of ADHD. This is a really complex process because ADHD is heterogeneous, meaning from one child to the next, it can look really different. And oftentimes ADHD overlaps with other difficulties, whether it's anxiety or speech and language difficulties. And so there's no one test, a blood test to say, yes, it's for sure ADHD. So we really want to ensure that we're not misdiagnosing ADHD for something else, or missing ADHD, or even not missing other diagnoses that might be happening along with ADHD. Difficulties associated with ADHD can also be affected. There's a lot of social and non-social factors that could look like ADHD, but are not really. So for example, a kiddo can look like they have ADHD if he's actually depressed or highly anxious, or if there's a lot of conflict within the family. With younger kiddos too, it can be tricky because we don't know, not everyone knows what normal behaviors are. And especially if it's your first child and you've never parented before, are these normal behaviors compared to other kiddos who are 3 or 4 years old? And even professionals tend to err on the side of caution, right? And just say, let's wait it out. But we know that waiting it out can be definitely problematic. So that's why we want to check out these early warning signs. So again, I talked about ADHD being diagnosed based on behavioral deficits, as I mentioned. And once we identify these early signs and we actually move to diagnosing ADHD, we need to use a practical definition of ADHD to guide assessment, because that's what helps us understand the child, but beyond the label of just ADHD, because you're not coming for a label. If you're coming to see me or a doctor to see if your child has ADHD, it's really not for the label. You're coming for help because there's behavior difficulties or these emotional tantrums, right? And so that's why we want to have a practical definition of ADHD, because that gives us information of figuring out what's going on, what are the impairments, what are the symptoms, but how can we help you? How can we support you? And I think that that's really important. It's not just about that label. And so we can use those early signs that I've already talked about as a practical definition, as well as the ones that are established as part of the diagnosis. So I've got a list here of all the different things that we can include in this practical definition. What does it actually look like in day-to-day life? So I've already gone through a lot of these. This is not at all an exhaustive list, but it's essentially those things we actually see our kids struggling with and the things that you might be struggling with as a parent or a teacher. Now, we got to remember, for behaviors to be diagnosed with ADHD, they have to be more frequent and more severe than other kids their age. So it's not that you've just, got a 3-year-old who's inattentive, because a lot of 3-year-olds are inattentive. It's got to be more severe. The difficulties also need to be seen in more than one context. So it could be at home, at school, at a friend's house, during soccer practice, at a restaurant, at daycare. We need to see it in more than one context. And these behaviors need to persist at least more than 6 months, because sometimes things, come up in our world. There's a lot of stress at home or in the family that can create a lot of problem behaviors. So we want to make sure it's persisting so that it's actually, ADHD and not something else that's going on. Now, we don't have enough time to go into all the technical specifics about diagnosing ADHD, but you do need to know you have to have a thorough emotional, social, behavioral, and even developmental assessment to be able to figure out, is this ADHD? We need to make sure that we see those difficulties across settings. So therefore, we need to get input from more than one person. Just one parent filling out a quick little snap form, an assessment form isn't enough. It's great to get input from daycare providers, teachers, coaches, other family members, right? I think that's going to be really important. And there's lots of things that we need to look at that could look like ADHD as well, right? So you got to make sure whoever you're going to see for an actual diagnosis is an expert in ADHD, but they also have a thorough understanding of not just ADHD, all of the other difficulties a child could be having that could look like ADHD, right? So there's other psychiatric difficulties or speech and language, anxiety, all of those kinds of things. Now, I do want to touch on as well, when we diagnose, we need to go beyond the symptom count. And oftentimes that's what ends up happening. We do a little rating form, 1, 2, 3, 4, 5, 6, 7, 8. Yeah, they meet the symptom count. But we need to really have this multi-dimensional sort of approach, a whole child approach to assessment. And we're looking at all areas of the child's functioning, right? And we need to make sure the strengths is a major area of focus when we're doing this. So we need to look at the functional outcomes and the conditions affecting functioning. So what is actually happening in their behaviors? How are they actually getting along with friends? What do their emotional meltdowns look like? All of those things are going to be important. And what are their triggers, right? What's happening before the behavior? What's happening after the behavior? That's going to be really important. Because if we're just looking at symptoms, that's not giving you information on how to support your kids in whatever context they're in, but it's also not giving us any information about long-term outcomes as well. What specific needs does this child have? And that's why we need to have this whole child approach. So we need to look at as well the emotional, social, learning difficulties, behavioral difficulties that are beyond just ADHD, because we know there's a lot of overlap with other things, which could be indicative of long-term difficulties. So for example, ADHD can predict school outcomes, for example, but it doesn't predict emotional outcomes, right? Or personality outcomes. Family relationships are really important for later life outcomes. So we need to make sure that's a piece that we're looking at. ADHD and speech difficulties, if there's a combination of those two things, they usually have a poor prognosis than just ADHD alone. So we want to make sure we are targeting everything that's going on for this child. And if there's impairments in the family functioning or in peer relationships or with learning, we've got to make sure we're addressing all of those things. And so that's why this approach is going to be really important. What's going on for this child in all of these different contexts? The family piece is going to be really important, not just the relationship, but there's also parental factors as well. Maybe there's employment problems. Maybe there's a lot of stress in the family, financial stress or marital stress, lots of stress, even just with the sibling rivalry that often happens. We also need to understand what's the parent's understanding of ADHD. All of these pieces are really important when we're going to look at how are we going to best support this child. It's really easy to get into all the deficits and areas of difficulty, but we really need to focus on the strengths of kiddos as well. So that's going to be important. And at the end of the day, we want to make sure when we're getting a diagnosis, how are we going to support? How are we going to actually inform intervention? And so that's a key piece of the assessment process, is figuring out how we're going to actually help them. So let's get a little bit into the multimodal intervention piece. When we look at the intervention, it's important to remember there's no cure for ADHD, no one thing that's going to help these kiddos with ADHD. It's about symptom management. And the best support is really this multi sort of modal approach where we're getting a variety of different interventions. I do also want to add exercise on there. I know with ADHD for myself, I do take medications, but they're ineffective unless I also exercise in the morning. And I definitely see this with a lot of kiddos too. I think exercise is a huge part of treatment because we know exercise helps our coordination, which a lot of kiddos with ADHD might have difficulties. It helps with our motor skills, but it also helps our ability to learn. Physical activity, we know it just helps promote overall brain performance. It helps control our impulses, our emotions. It improves our focus and attention. So all of the difficulties that a lot of kiddos with ADHD have. So we want to add that piece in. I also want to add play. Our kids are just not getting enough playtime in general, but it's really important. Play is an important part of self-management, self-regulation, and kids can start to figure out what kind of mind they have and what they love about life through play. So I wanted to throw that in there as well. So when we're looking at behavior modification, this is a huge part of managing symptoms related to ADHD. And this is what I'm going to focus on a little bit, and especially the parent training component and of behavior therapy. This is critical because parents, they do influence kids' self-regulation and emotion regulation skills from a very early age. And those are the areas of difficulty a lot of our kiddos with ADHD have, and especially our younger kiddos when they have a lot of emotional dysregulation difficulties. Parent training makes a huge difference in kids' lives. And there's a lot to cover, which goes well beyond what I can do here in this webinar. I do have an ADHD parenting masterclass, though, that goes through every component of this in great detail. But for today, I really wanted to highlight some of the key components of parent training. First, of course, is understanding the ADHD brain, so we don't have unrealistic expectations. And I'll talk a little bit about that as well. We need to have strong bonds with our kids, which is strengthened through effective communication. So we need to know how to respond effectively to our kiddos, especially when they're upset. We need to make sure we're, the positive reinforcement, highlighting the behaviors we want to see, because whatever we're focusing our attention on is what we're going to get more of. So if we're focusing all of our attention on the bad behaviors, we're going to get more of those. So being able to focus on some of the positive things. We want to create lots of opportunities for our kids to be successful and to start experience greater independence. And parents also need to know how to use consequences effectively and consistently to help regulate some of the behaviors. Positive interactions, we know, is a huge part of the relationship as well. The effective communication piece is important, but also just spending quality time. And it's important for you too, just loving spending time, having fun with your kids is going to be really important. And then, of course, managing our own stress, because stress is contagious. And if we're stressed, chances are we're not responding in very effective ways to our kids, and they're going to pick up on it as well, especially our younger kiddos. Our relationship with kids is the foundation for positive behaviors. A strong relationship makes a critical difference in outcomes, especially for kiddos with ADHD, and it's the greatest predictor for long-term happiness. So it's really important to know that it's a huge protective. Our relationship with our kids is a huge protector factor for our kids for long-term difficulties, which I've got listed here. So changing how we interact with our kids is huge because we can create a lot of stress in our interactions, even when we're trying to be helpful with our kiddos. So that's why being able to communicate effectively with them is so important. And it's a key part of relationship building. So, being able to understand our kids and listen to our kids is one part, but really at the end of the day, to be effective, they need to feel understood. They need to feel heard. Because oftentimes parents will say, well, I was listening, but the kid didn't feel like they were actually heard in the first place. So it's listening fully without getting your side of the story, without getting your big butt in the way. So yeah, I know you always forget, but I'm always telling you, I'm always reminding you, yeah, I see that you had problems with your friends, but you were always in their face. We're always doing that. And then we're kind of minimizing how they feel. And when we get our big butts in the way, it's really disrupting our connection with our kids. And it gets to the point where they don't even want to come talk to us anymore because we're not really listening. The other thing that we need to do as well, not just communicate effectively, but not always nagging them and telling them what to do. Oftentimes I'll tell parents, this is the first challenge I give them is try to go a week without giving your kids any corrective feedback, because all they hear is nag, 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 nag. And as soon as we demand something or nag something or remind, go wash your hands, we're just stressing out their brain. And when their brain gets stressed out, their thinking part of their brain shuts down and they're not able to follow through. So it's about asking kids, hey, kiddo, what do we need to do to stay healthy, before we eat? Hey, kiddo, it looks like a great video. Where's a good place to pause it so we can come eat dinner together as a family? Right? Versus ordering and demanding and stressing their brain out. So here's just some key points. Again, I'm not going to go through them all, but how you can communicate effectively. And I do have in that accompanying resource, which is in the resource section that you can download, I've included a little booklet and it'll help give you some more information about how to listen and communicate effectively with your kids. Understanding the brain is huge. There's a lot to learn. And again, it's a week-long webinar really to go through everything with the ADHD brain. I do have a lot of details in my parenting masterclass, but the executive functions, that's this part of the brain that helps us regulate our behaviors, regulate our emotions, think before we act, make good decisions, follow rules, all of those things. It's the last to develop, even for typically developing kids, but it's delayed for our kiddos with ADHD. So you need to know, a lot of our kiddos, I like to equate it. There's this thing called spoon theory. And so essentially, if we think of every executive function, so being able to think about my actions, keep my cool, remember my morning routine, each one of those is a resource block. And if we pretended each resource block was a spoon, let's say all kids start with 16 spoons. Kids with ADHD are already at a disadvantage. Maybe they only have 12 spoons. So every time we ask them, hey, kiddo, go back, pack your backpack, I give over 1 spoon. Now my sister just bumped me and I'm trying to keep my cool. That's probably 3 spoons. Essentially, it's a resource that's quickly depleted. And it's very effortful for kids with ADHD, even just to remember and think about my routines. And every time I do, I'm giving away one of my spoons. So by the end of the day, probably by the time they get to school or preschool or recess or lunch, they've given up all of their spoons. There's no resources to keep our cool. So I think that's really important because we need to reserve those resources and replenish those resources as much as possible because they have fewer to work with in the first place. And part of what we do with that is we set up the environment for them to be successful. If we can create an ADHD-friendly environment, then, they're going to do a lot better. So that's a big piece. And I love the Superman sort of analogy. Just like Superman, sometimes we need a phone booth to show our strengths. And that's what we can do within our environment. Here's a few examples of what's an ADHD-friendly environment and ones that are not helpful. The other thing is, too, just making sure that our expectations match what they can actually do. I've already talked about the benefits of movement, so I'm not going to go into that, but that's really important, that exercise piece. And actually, the exercise is more valuable for kids with ADHD, even more than typically developing kids. So I think that's really important. The other thing is we're going to set up the environment for them to be successful, but we also intervene at the level of the person, which means we got to motivate our kids. Because in the ADHD brain, the dopamine's released at lower rates. And essentially what happens is they don't have that same intrinsic motivation and they can't switch off that part of the brain that results in mind wandering, for example. And so they're not able, without those immediate rewards or motivation, they're not going to finish what it was they were supposed to do. They're not going to remember the rules and all of those sorts of things. So I think that that's really important for us to think about. And there are big differences. So low incentive, the mind wandering. There are big differences in the brain. So if we can see here, the typically developing brain and the ADHD brain, there's a lot of differences, and it almost looks like big black holes. And it's because the brain isn't on, the dopamine's not working. I'm not engaged. I'm not interested. So if we have a task that looks way more effortful than what, the actual immediate reinforcement's going to be, we're not going to follow through. It's going to be too much. The interesting thing is when motivation's high, when we do have reinforcements in place for our kiddo, you can't tell the difference between their brain. The brain activity is exactly the same. So that's why the motivation, the reinforcement piece is so important. And so we got to make sure, that we've got those incentives that's worthwhile for doing that task. That's really important as well. So looking at, if we're having difficulties with getting our kids to eat broccoli, for example, how can we support them and make it a little bit more interesting, get them a little bit more engaged? I think that's going to be really important. The other thing we need to ensure when we teach our kids is to make things explicit. Oftentimes we take for granted. We just say, follow the rules, act your age, grow up, right? We're saying things really vaguely. And so in their head, they think, oh, this is what acting my age is, right? Or if you say, okay, you told us to get along, Mom, but you didn't tell us we couldn't destroy the house with our pillow fight, right? Or I act my age. Don't all 3-year-olds paint on themselves, right? We need to be very explicit about what it is that we're talking about. I wanted to talk just quickly, again, self-regulation is a whole 12-hour webinar, but it is a key deficit of ADHD. In self-regulation, it's really the skill of managing ourselves, our emotions, our behavior, our body movement, our ability to manage all of our impulses, all of those types of things. And I've got a picture of a thermostat here because self-regulation really is like a thermostat. A thermostat set to a key point, a desired temperature. And to do that, it keeps track of the environment all the time. And if it's getting too hot or too cold, it self-adjusts to keep at that set point. And so to stay at that set point, we really have to be aware of everything going on within us and within our environment, right? How we're feeling, how we're behaving, what else is going on, what the expectations are. But there's a lot, if we look at the self-regulation, there's a lot of skills here that are necessary to develop to self-regulate. These skills are all really hard for kiddos with ADHD. That's the part of the brain that's delayed, right, in development. And so as I go through all of these, I can't do them here and now, but you can see there's a lot of skills, especially our young kiddos with ADHD as well. So essentially why I'm bringing this up is they need help. Just telling them the rule isn't going to be enough. Expecting them to follow through isn't enough because it's very effortful and they are depleting all of those resources. It's just stressful even to cope with a lot of things. So the biggest reason I bring this all up about self-regulation is that right now, the only way we can really help our kids develop self-regulation is through co-regulation. You have to be their surrogate frontal lobes as it's still developing. That's going to be a key part of self-regulation. And part of this is understanding the difference between misbehavior and stress behavior. And when we look at that, we got to be really good detectives. Why is this behavior happening? What's going on for this child? Why right now? Right? So if we can start figuring out, is it actually misbehavior or stress behavior? And I'll tell you right now, most of the time, it's probably stress behavior because misbehavior is when kids are fully aware of what they're doing and that they shouldn't be doing it. And it means it's within their capacity to do something differently. So it might be, hey, kiddo, you shouldn't be having a cookie right now. And then, the kids watch you leave and then they sneakily come into the kitchen and steal a cookie from the cookie jar. That's misbehavior because they know exactly what they're doing. Stress behavior, though, they don't have any of those capacities. It's out of their control. And so we need to really know the difference between the two so we can help support them. If we think they're being manipulative and mean and cruel and all of these things, we're going to respond in really unhelpful ways. And it's not just figuring out what's going on for your kids. You also need to figure out what's going on for you, right? If you're stressed out, you're not going to be able to co-regulate effectively. And then we just get into this kind of spiral of behaviors. And it's part of the communication piece as well. So I've got some examples here of parent emotion-related behaviors because we know parental emotion-related behaviors, the positive ones, but also the negative ones. It plays a key role in kids' development and their ability to regulate their own emotions. And it really comes back to the relationship, which is a key piece of supporting that self-regulation. One last piece about the behavior management that's really important. Again, there's so much to go through, and it's one area that, we could spend weeks going into. I do talk about it in my masterclass, but these are some of the behavioral expectations and strategies, making sure we're involving the kids in those consequences and behavior plans, starting really small. Focusing on the positive things. We're practicing skills. All of these things are going to be really important. Now, kids often confuse their behavior with who they are as a person. And if they're hearing that they're forgetful all the time, or a slowpoke, or they're bad or manipulative, they start to internalize that. And our kiddos with ADHD, by the time they're 12, they receive more than 20,000 pieces of negative feedback. So they're hearing so much more negative feedback than other kiddos, and they start to believe that they are bad kids. And so that's why I like to externalize behaviors, give it a name, brain snatcher, body snatcher, mean gene, whatever it is, so that you and your kid can team up against these behaviors and work together, right? And I think that that's really important when we're externalizing. Finding the antidotes, you've heard it before, find them being good. Whatever we give our attention to is what we're going to get more of. So if you don't want them punching your sister, find the antidotes, the things that is the exact opposite. So when they are getting along with their sister, for example, we're looking for those positive behaviors. The other thing is we got to make sure we're practicing with our kids. Telling them is not enough. Right? We could talk for 10,000 hours about how to swim, but I wouldn't expect them then to know how to go and jump into the swimming pool. They need to practice those skills. And it's the same thing. We lecture about all of the behaviors. They know that they shouldn't punch their sister. They know they shouldn't kick other kids. They know they're not supposed to scream. They know the rules. They just can't do and hold their behaviors and emotions together in the moment when they need to. So we need to practice. So for example, if you've got a kiddo who doesn't like losing a board game and they freak out and they throw the pieces everywhere when they're losing, we're going to set up a structured practice. We're like, okay, kiddo, we're going to work on you losing. This is your job. These are the strategies you're going to use to keep your cool. And I'm going to win. And I'm going to cheat to make sure that I win, right? So we're setting up lots of practice so they know, I can do it. I know exactly what I need to do. Those types of things are going to be really important. I just want to quickly talk about the role of medications, because it is a key piece of ADHD. Now, I just want to put that disclaimer out there. I'm not a medical doctor and I don't give advice on medical management. However, as an expert in ADHD, I do need to have an understanding of medication, and it's because it is such an important part of ADHD. So when we're looking at the medication piece, we know that the most effective treatment for school-age kids is a combination of both the behavior modification and the medication. But things are a little bit different for our younger kiddos. And I think that that's really important. So like under 6, for example. So there was a study done, the National Institute of Mental Health. They funded a preschool and ADHD treatment study, and they looked at the short and long-term effects of methylphenidate, of stimulant medication, on preschoolers. And before starting the medication, all of the families first had to complete an intensive, I believe it was a 10-week behavior therapy program. And one of the most significant findings that they found from that research was that 1/3 of the children showed such a reduction of the ADHD symptoms after that behavior therapy, they didn't actually even need the medication anyway. So they didn't receive it. So from that study, the researchers concluded that behavior interventions that are focused on reducing the symptoms of ADHD is really the first line of treatment for young kiddos. And so that's why I focus so much on the behavioral piece and why we do, especially for younger kiddos. And so what we end up doing for kiddos under 6 especially, but even some of those kids who are just getting into school, we always start with behavior therapy first. When that doesn't meet, the needs of the kids, and we're still seeing a lot of impairments, that's when we would start considering the medication piece. So I think that that's really important. But as they get into school, we know a combination of the behavior therapy and the medications is going to be really important. And we also know medication protects and actually promotes kids' brain development. So they are a very important part of the treatment piece, and the medication just can help them with their attention and impulsivity and all of those types of things. Now, although the medications may be effective at reducing core symptoms of ADHD, they're not skills. So I always say pills aren't skills, right? So we might have a kiddo who can now pay attention for longer, but maybe they don't know what they're actually supposed to pay attention to. My eldest daughter with ADHD plays ringettes. And for years, as when other parents were yelling, skate, 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 I'm yelling, focus, focus, focus. And finally, by the time she was 12, I'm like, why can't I get through to her? Why can't she focus? And because every time she's like, Mom, I'm focusing. And then I clued in, what is she focusing on? Right. And so then I actually explicitly had to tell her, focus on the ring, your eyes when you're on the ice. So the ring, if you don't know ring, is kind of like hockey, but there's a ring instead of a puck. Focus your eyes on that ring. That's what you're focusing on. And it was like a light bulb. It's like, oh, now I know what to focus on. So we still need to teach skills. That's kind of the other piece that we need to look at. Where are kids struggling? So fast and furious. It was so much information. In addition to the handouts and accompanying resources, you can also find out more about my ADHD Parent Masterclass. I've got the link here for you. For joining me today, I do have, the viewers can have a 20% off. If you do want to sign up, you can just add the word webinar with a capital W into the coupon code to get that 20% off. But I want to open that up to you guys if you wanted to learn more details about each of these areas. So thank you very much for joining me today. And I think we've go into some questions and answers.
Yes, thank you so much, Dr. Buzanko. That was chock full of not only great background information, but really usable tools for parents as they try to navigate executive functions and positive self-esteem, positive parenting. So thank you so much. And we do have a lot of questions. So I will dig in here. And the very first one is very easy. You were just talking about the medication study, overall treatment study, and someone asked if you could just repeat the name of that study.
Yeah, so it was the National Institute of Mental Health, NIMH, and it was the PATS study, PATS.
Great. And you will see that referenced in many places on the Attitude site as well. So if you Google it, of course, and it's cited quite often. So wonderful. So I'd like to back up a bit to the segment that you did on emotional dysregulation. And I think it's so fascinating that is really one of the earliest signs of potential ADHD, especially in younger children, not necessarily, the hyperactivity that a lot of people expect, though it certainly could include that. A lot of questions about just the different manifestations. So you mentioned, anger and low frustration tolerance. Could it also include things like being overly dramatic? As a sign.
Yeah, overly dramatic. It's just an excess of everything. So even like sensory difficulty. So kids who are even more like, I've got kids who are so sensitive to smells, their parents literally have to put essential oils under their nose anytime they leave the house, for example, right? So it's an excess of emotion. It is. They're little drama queens, boys or girls, right? They're over the top in every sort of reaction. Even like if you're like, hey kiddo, can you push your cup, close off, into the counter a little bit more so it doesn't spill. Oh my gosh, why was I born? Right? Like, just oversensitive to any slight, whether it's something doesn't go their way or they're getting feedback or their friend didn't want to play with them, anything really that goes outside of their expectations, there's a big sort of reaction to.
Right. And this leads into another common question that we got, which goes into the whole complexity of comorbidities. And a lot of people asking, gosh, a lot of these, the emotional dysregulation, but also the sensory, sound a lot like sensory integration disorder or sensory processing disorder. Are there any hallmarks that would help a parent discern between the two, at a young age?
Yeah. Well, we know the majority of kiddos with ADHD do have other difficulties like sensory processing disorder, right? Or developmental coordination disorder. One thing, maybe I should make sure that I say too, executive functioning difficulties and self-regulation, emotion regulation difficulties isn't just ADHD, right? It is one hallmark of ADHD, but there's lots of other things that could be going on. So when we're looking at differentiating, it really does come down to the inattentive piece and the hyperactive piece when we're actually making the diagnosis. So I think just the emotional regulation is often it's overlooked, even though it's a huge piece. But those are where we would start looking at, how do we differentiate how much of it is the sensory processing disorder versus ADHD. But I got to tell you, there's a good chance it's both, because we know, like I said, 87% of our kiddos have something else going on.
Right. So I assume the big piece of this puzzle is finding a practitioner, right, who recognizes the overlap and can help to not only tease out the symptoms, but also recognizes the treatment protocols that are most effective for kids who do have more than one condition. We had a couple of questions along this line. Do you have any advice for what questions a parent should ask when trying to find a good clinician?
Yeah, actually, I should pass along. I've got a article that I wrote. Maybe I'll pass it on. You can add to the resource center.
Absolutely.
Just about how to find a good doctor, right? Because you do want to make sure what's your experience with ADHD, but what else do you know? It can't just be ADHD, right? You need to know all of the other difficulties kiddos could be having. And that's why it's such we can't just do a rating scale. You can't just go to your doctor and do like one little rating scale form, because there's so many other pieces. I'm listening to families, the stories. And that's a big piece of it, is listening and understanding, okay, so, did he have chronic ear infections? Did he have troubles learning to ride his bike? It starts giving me clues on different types of things, how, looking at transitions and the sensory difficulties and all of those types of things. It's someone you kind of get a sense. You can ask questions about what your background is and what do you know about all of these different things. But as a parent, how are you supposed to know all these different things too, mm-hmm. right? You don't necessarily know either. So I think it's just getting a sense, is this person spending time listening to my story? Do mm-hmm. I feel as a parent like they really understand what's going on for my family, what's going on for my kiddo, right? And I think in asking, I talked about those social sort of things within the family. It could just be lots of high family stress that's happening that could look like ADHD as well. And so it's being able to look at, is this person going to do a whole child approach? And so asking, what is your approach? What does an assessment look like? How do you make the determinant diagnosis at the end of the day? How do you figure out, how do you differentiate what's ADHD or not?
Right. And we're getting a lot of questions from parents, is how do you tell the difference between ADHD and fill in the blank? It's true, like oppositional defiant disorder has come up here. We have stats that, about a quarter of boys with ADHD show signs of oppositional defiant disorder and about 10% of girls. And the overlap with autism spectrum disorder, sensory processing disorder. We have, huge sections of the site all about this. It really is critical to find a clinician who is going to take into consideration, as you said, the full story. Not just look for a quick fix.
So it's not just about the label. And I think I talked about that too. That's why symptom count is only one piece. We got to look at the impairments, because at the end of the day, yes, it's important to know if it's autism versus ADHD as they get older. Right now, It's still the same intervention. We're still going to do behavior therapy. We're going to look at, where is this child having difficulties? Where are their behaviors disrupting, their success in life? We're going to approach it with behavior therapy. But once they start getting into school, right, and getting a little bit older, we need to know the difference, because autism isn't medicated. ADHD is. And so we do see some different outcomes. But again, it's things that you wouldn't necessarily know as parents. Like, I know a child with ADHD and developmental coordination difficulties and visual spatial reasoning difficulties looks a lot like autism, but it's not autism. It looks a lot like autism. But early on, for now, if you do have younger kiddos, the intervention is really the same. It's that behavior therapy addressing all of the areas that they're having difficulties with.
Right. We did have a few questions, just a quick follow-up. You mentioned that you screen for a history of ear infections. What's the connection there?
We don't really know why, but there is a high correlation between chronic severe ear infections and ADHD. So we don't know if it's, an auditory processing difficulties that can contribute, or we're still trying to figure out the why, but there is a high correlation there. Still, there's a high correlation with if you were induced. We're still trying to figure out all of these little things, but that's a question I ask. Were you induced in your pregnancy? Because there is a high correlation there.
Interesting. I hadn't heard that. Mm-hmm. Yeah. Mm-hmm. And this leads into another theme here, which is the genetics of ADHD. A lot of people wondering if ADHD runs in your family, diagnosed or otherwise, should that be another box that you tick? Is your child more likely? And should you be looking for the signs of it more than you would otherwise? Should you really persuade your clinician to not write this off as typical childhood behavior?
Absolutely. Now, there are things that can contribute, but genetics is a huge reason why we might have ADHD. And it's always a question I ask, not just parents, not just siblings, but extended family members. Is there ADHD in the uncles and aunts and grandparents and things like that? And even if it's not diagnosed, I listen for stories. Okay, how far did dad make it or grandpa make it with education, right? Did they drop out of school? It would have been common in certain generations, but that family piece is a huge piece of the puzzle. Absolutely. And if there is ADHD in the family, you are definitely at greater risk.
Right. And a lot of parents here are saying, here's one question: how can I help my child if I don't treat my own ADHD first?
And that's one of the things that I had said. Maybe I said it really quickly when I was talking about diagnosing. We need to see what's parents' understanding, what's their capacity. Because oftentimes when we're butting head, it's because the parents' executive functioning skills are still developing. And though it's the exact same executive functioning skills that their kids are having difficulties with. And so most of my work with a lot of families, it's dealing with their own emotion self-regulation as parents to then help support their own kiddos.
Mm-hmm. And please correct me if I'm wrong, but the behavioral therapy that is successful with a lot of children with ADHD has a heavy parental component, basically parent training in many instances. Is that right?
Absolutely. And most of my work, I do work with kids, but I hate putting so much pressure on the kids because there's things that we need to do, like I said, at the environmental level, but there's also things that we need. So, structuring the environment, but there's things that we need to be doing to help support them. We have to be their prefrontal cortex. And so parents need to learn what that looks like, what that means. How do I support them? So a lot of my work is actually with the parents. If we put too many demands on the kid to self-regulate, then, we're expecting you should be able to do that. No, wear their prosthetic. Just like if, you've got a kiddo who doesn't have a leg and they have a prosthetic leg, we wouldn't take that leg away just because they've learned to climb the tree once, right? That leg is always going to be there with them until they're an adult for the rest of their life. So we got to kind of keep supporting them. And so that was a long answer to say, yes, parent involvement is necessary. Right.
And this is kind of going back to the root causes. Some people wondering if the amount of time that kids have on electronics. I guess it is of great concern now, especially with so much remote schooling. Is that having a detrimental effect, especially on ADHD brains? Can it exacerbate existing underlying symptoms or even trigger symptoms?
Oh my gosh, I could talk forever about this. This is my greatest concern with COVID was how much more screen time kids are getting. Now, here's the thing. It won't cause ADHD. So we want to make sure that that's ruled out. But yes, it can definitely make things worse because in the ADHD brain, it's the dopamine system. And the dopamine system is the reward system of the brain. That's what's not working. And it's not communicating effectively with the rest of the brain. So that's why kids can pay hours of attention on video games, but you ask them to do one little math problem and it's like, well, I can't do it and I can't focus or anything like that. Nothing is as stimulating as screens. And if you like the developers of even things like Instagram and Facebook, they purposely make them addicting, right? So they have algorithms so that anything that they know will interest us is going to pop up and keep us on for longer and longer and longer. Kids with ADHD cannot self-regulate that kind of stuff. So even just the screen itself is very stimulating. And so, it makes it even harder for them to go then try to read a book or to go do a worksheet because those are boring. It's not exciting the brain. And kids with ADHD are drawn to whatever makes the brain feel good. And video games absolutely do. And what ends up happening if you've got a kiddo who's on for more, well, there's definitely guidelines. And for our older kids, 2 hours a day, babies under 2 should not have any screen time at all. And then, 20 minutes as toddlers up to an hour at most. But anything more than that is very addicting. And we see the exact same parts of the brain in like cocaine addiction light up with screens. And so that's why when you're trying to transition your kiddo off of a screen to go for dinner, for example, you have a huge meltdown. It's withdrawal symptoms. And all they can think about is their game and their game and their game. And they could spend hours on it. So, it's a huge problem. And it's definitely making attention and behaviors and emotion regulation, self-esteem, everything worse.
Yeah. And we're stuck without many options, especially those of us who are remote schooling and classrooms are there on a screen, and one tab away could be a really fun game that can draw your attention away. It's
well, and
so
even
difficult.
Reading, like there's even reading programs, if you've got a younger kiddo who's doing like, there's like Epic Books or Raz Kids, or, maybe that's part of what they're doing. They're losing out on that opportunity to hold a book, to learn to turn the pages. There's a lot of those developmental things. And on screens, you don't read as deeply as if you actually read a book. So we have scanners, right? Like we're quickly, and you probably know this too, you're just quickly scrolling through stuff, not actually reading things deeply. And so we're losing out on a lot of skills, and empathy is a big one. When kids aren't holding a book, reading a book, there's a lot of empathy. We've actually seen a decrease in empathy in a lot of kids with the increase of technology.
Wow.
Yeah.
Wow. The hits keep coming, 2020. So on a bit of a more, I guess, hopeful or proactive angle here, counteracting this, you mentioned that exercise is essential. And we had a number of questions asking about just assuming that your child is home and on screens, what kind of exercise and what type of day? So, parents were asking, is yoga better than aerobics? Should we do it first thing in the morning? Breaks in the middle of the day? What are your thoughts on that?
Well, for me personally, first thing in the morning, it has to. Like I said, if I miss my workout but take my medication or vice versa, I'm a wreck for the rest of the day, even if I work out later on. So morning is definitely good. And especially, I mean, now with COVID, not everyone's going to be going to school. Not all kids are at school. But if you're rushing through your day, get your backpack. We've got to go to, I'm going to be late. And now they're at school. All those spoons I talked about are going to be depleted. If you're a teacher or, have a classroom, right then and there is going to be really important to do some exercise, because they're just to help get rid of some of that cortisol. Before any hard task, if they have to sit down and do math, or writing is a big one that a lot of kiddos with ADHD, doing something hard, some physical activity right before. The best exercise to actually promote brain development and attention and impulsivity and all of those types of things are cognitive sort of exercises, things that kids have to think about. So yes, yoga, taekwondo, sports. If you can get your kids on a sports team, that is going to be one of the biggest, other than your relationship with your child, is going to be one of the best protective factors for your kiddo. And especially ones that have strategy. So ball sports, or, my girls play ringette or hockey, things like that, because there's strategy in there. So the more those kinds of sports that they can do, the better.
Right. And even now, there are opportunities. I mean, my kids are running cross country, which is the perfect sport for social distancing. So you might have to get a little more creative in 2020, but there are still opportunities. Swimming, Michael Phelps is our prime example, right? And also along these lines of helping kids to, as you mentioned, like transitioning off of screen time can be very difficult. Your thoughts on reward systems and incentives that might help with those behaviors?
Mm-hmm. That's a tricky one. Yeah. I mean, the first and foremost, and I know that I do a lot of, work on screen times with parents, and they're just like, how can we possibly take screen times away? I use screen time as maybe a reinforcement. If it's a problem, like I had, in my house, watching 2 20-minute shows is a nightmare. 1 20-minute show, my kids can easily transition from. 2 is a nightmare. And so it kind of got to the point of not so much reward systems, but it was kind of a privilege responsibility. So you have the privilege of using this technology or watching the show or whatever it is, but your responsibility is to shut it off when it's time in a cool, calm, collected manner. Mm-hmm. So of course, my kiddos are a little bit older, so you can't tell, a 3 or 4-year-old that, but they knew. So if they were freaking out, they're losing their privilege because they can't maintain that responsibility. And we all have that, as adults, we have the privilege of driving, but we have the responsibility to drive within the speed limit, for example. There can certainly be, I love ticket systems. That's my favorite thing for anything, whether it's trying to get kids to go to bed at night, but we could use it here. So it could be maybe, you know what, you showed me that you could get off that game really well. You're going to get a ticket for more time. You get 5 minutes extra tomorrow or something like that. So you could use a reinforcement system. Better, though, is if you've got a kiddo, let's say they're playing video games and they're sitting there watching, playing their video game. Oftentimes we're like, get off, or 5 minutes or whatever. Kids with ADHD don't have any sense of time. So if you say 5 minutes and actually give them 35 minutes, they'll be like, oh my gosh, that was only 2 seconds. You didn't give me any time at all. They have no sense of time. So that's not helpful at all. The best thing you could do really is to sit down with them and then start asking questions. Oh, what game are you playing? Oh, who's that guy? What do you got to do? Can I play? So what we're doing is we're bringing their attention away from the game bit by bit by bit by bit, because otherwise their brain is like latched in there. And so if we're trying to get them off the game, it's like dumping a big bucket of ice on top of them. And it's so jarring and even painful. So if we sit down next to them and start talking with them, that we're pulling slowly their brain out of the game and then working with them. When's a good time? When I was a kid, it was ping pong, or you had 3 lives and you're dead, within 5 minutes was realistic. Now there's games go on and on and on and on. So it's asking the kiddos, when's a good time, to get off and sort of talking with them. And it's that collaboration and effective communication. For me, that would be way more effective than, a reinforcement system that you're probably going to have to change in a couple of weeks anyways, because kids with ADHD like novelty, and a lot of reinforcement systems that we put into place work, for 2 days and then it's boring. It doesn't work after that.
True. Well, I'm going to try that one tonight myself. Thank you. And this has been incredibly helpful. We have gotten just a ton of parents thanking you so much for these strategies and insights. We could have gone on for another hour with these questions, but we will wrap it up. I will thank you, Dr. Buzanko, so much for this presentation. And we're so happy you could join us today. And
thanks for having me.
We hope to have you again.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.
You love podcasts, the stories, the laughs, the unexpected turns. But when this episode ends, the silence starts. Not anymore. Audiobooks.com turns that silence into your next great adventure. With over 450,000 titles, from bestsellers to hidden gems, your love for listening just found its new best friend. And because you already know the joy of audio, we're giving you 3 free audiobooks to start your journey. Imagine your favorite podcast, now with unlimited episodes. That's audiobooks.com. Keep the story going. Sign up for your free trial at audiobooks.com/podcastfree today. Because for podcast lovers like you, the end of an episode is just the beginning. That's audiobooks.com/podcastfree.